Welcome back to You Heard It Here with Dr. Gary. This is earwax removal log number 120. In my last episode, I tried to do the earwax removal in silence. It's just not me. Unfortunately, if you don't want to hear my voice, but you do love watching this content, hit the mute button. As you can see, this patient has a lot of earwax at the bottom of their ear canal. And as the curette's touching it, it's almost scraping along the top. It's not digging in at all. This earwax is rock hard. It's like a little rock or a pebble in the patient's ear. The patient actually reported that when they use Q-tips, which they shouldn't be doing, they could actually feel something hard in the ear canal. And then when they pushed on it, it caused pain. Outside of saying, don't use Q-tips, they're not good for you, I'm also going to say if you're doing something and it hurts, you should probably stop doing it. As we remove this earwax, we're going to roll this large chunk of wax out of the ear canal and try to keep it all together, which in this case is really not hard because that stuff is just stuck together. All right, let's see what this looks like. You can see it there in the ear canal. And as it comes out, let's see what we've got. There it is. It's almost like a little rock or pebble on the ear. Here's my disclaimer. This is for education and entertainment purposes only. If I have not seen you in my clinic, I am not providing medical advice. This patient had a great view of the eardrum after we removed that wax. There is a little bit of redness down there, and we'll have to see them back in a little while to see if that redness goes away. A different patient here. This patient has a very different problem. Their earwax is not nearly as hard, but this wax is a lot of dry, dead skin all in there. As we use the curette, we can pull away that outer layer. You definitely see that there is a lot more wax hidden behind. We're going to use the curette again to just pull this wax out slowly and gently, avoiding any discomfort for the patient and trying to get us a good view of the eardrum. Unfortunately, that view has not come up yet. If you like these wax removal videos, please take a moment to like and subscribe. It really does help with the YouTube algorithm and helps to keep me motivated to put out this content. I've been trying to post at least one new video a week. We used a little bit of irrigation to get that last bit out, and now you can see a great view of the eardrum. This has been You Heard It Here with Dr. Gary. Thank you for watching. I'll see you in the next video.